Hi everyone, Elizabeth here again. So last week I talked to you about cancer and exercise, and this week I'm going to be talking to you about multiple sclerosis or MS and exercise. So this is a little bit of what I plan to talk about, just an overview of what MS is and how exercise and MS impact each other. So I'll start with what is multiple sclerosis or MS, as it is most commonly referred to. It's a chronic inflammatory or a demyelinating disease of the central nervous system. Right now there's unknown cause, and I'll get into a little bit more of what demyelinating means in a later slide. It currently affects about 2.1 million people worldwide, and the onset is usually somewhere between the age of 20 and 50, with the average age being about 34. Or depending on some sources, they may say 30, but again, it's just an average, and it's usually in between that range. Women are about 2 to 3 times more likely to develop MS than men, and it's more common in those of Northern European descent, so more of your Caucasians than African Americans, Asians, or other races. And exercise has no effect on the prognosis or progression, but it may improve the short-term physical fitness and functional performance, which functional is going to be more important for those with MS than how much they can lift. It's about them being able to get through their day-to-day life with as little impact as possible. So this slide just kind of gives you a picture of MS. Said that it's an autoimmune disease, so that's when the body attacks itself. It's more common in women than men. There is some research that shows that it tends to run in families. Other times there's no known cause, like I said earlier. Some of the symptoms include tinnitus, which is ringing in the ears, decreased hearing, urinary retention, so the bladder does not empty itself, or spastic bladder, constipation, weakness in the muscles may actually progress to paralysis, so the person may end up in a wheelchair. Muscle spasticity is when the muscle basically just can't be controlled, and it can either fall or have uncontrollable muscle movement. Onset at this source said between 20 and 40. Again, it's usually between 20, 50, 60, depends on the source that you look at. And other symptoms include diplopia, which is double vision, blurred vision, dysphagia, difficulty swallowing, dysarthria, difficulty speaking, nystagmus is when the eyes can't focus on the same thing, so one eye is looking to the right, other eye is looking to the left. And then this is what I was talking about earlier with demyelination and the central nervous system. The way the nervous system works is the dendrites is where a impulse is received by the cell. It's processed inside the nucleus, and then the message travels out along the axon to the axon terminals where it'll cross a synaptic gap to the next neuron. Now, myelin is a small insulating fatty layer on axon, and this helps speed up nerve impulses. So if you touch your hand on a hot stove, the way you're able to pull it away so quickly is because the nerve impulse is able to travel along the axon very quickly. And the way the myelin does that is, in between each myelin and sheath is the node around the and the nerve impulse is able, for lack of a better description, to skip over the myelin sheath to the next node around the So the more myelin, and the faster it's able to process. And in MS, these myelin sheaths start to degenerate, and then impulse isn't able to travel as fast. So this is just as a visual representation of what a normal, healthy nerve cell will look like. Actually, see the myelin sheaths, and then in MS, the T cells, which is part of the body, is the immune system, goes and attacks the myelin sheaths and destroys them. Well, this could either lead to nerve pulses not traveling as quickly as they need to, or traveling at inappropriate times, or not even traveling at all. And some different diagnostic tests for MS. It's difficult because it can mimic other diseases. So it's important that the physician has a complete history and performs a complete physical, which will usually include a complete blood cell count, or CBC. They'll also look at blood chemistry, urinalysis, a spinal tap, and they'll probably also refer the patient to a neurologist who will order a MRI of the brain and spinal cord to see whether or not there is any sort of demyelination going on. And some common treatments, the ones that are in bold are ones that are disease process inhibitors, for lack of a better description. And what they're trying to do is modify the progression in MS, hopefully to slow it down, or at the very least, limit any exacerbation of symptoms. And then these that aren't in bold are symptom management. And as you can see, a common side effects include flu-like symptoms, irritation of the injection site, fever, chills, swelling, and shortness of breath. And you want to pay particular attention to side effects that the person is experiencing, because this will be important when you're doing exercise testing or prescription, and because as you want to modify it based on their symptoms. So now I'll get into exercise and MS and how the two impact each other. So when you're going to be performing exercise testing on someone with MS, you want to do it earlier in the day, because as the day goes on, there's usually a greater impact on the results because fatigue worsens as the day goes on. And if they're experiencing acute exacerbation of symptoms, you want to reschedule that because those symptoms are going to impact the results. You may want to use an upright or recumbent bike if they're experiencing issues with balance. This way, it helps promote safety. You'd also want to use the foot straps to help prevent the foot from falling off because of muscle spasticity. Heat sensitivity is also very common for those experiencing MS. So you want to use cooling fans, have plenty of cool water available. You also want to keep the temperature of the testing environment lower. That way, they're not having to deal with not only the rise in body temperature from exercise testing, but also from the environment itself. If you're able to test upper and lower extremities together, it could help minimize the impact of local muscle fatigue. So you can accomplish this by using something such as a new step. Or if they're able to balance, you can use an elliptical. Joint range of motion and flexibility is extremely important in those with MS because of the muscle spasticity and the possibility that they'll develop contractures where the muscle is stuck in a shortened position. And it's seen a lot as the disease progresses. And what a contracture looks like is basically, instead of being able to fully move with the fingers and the hands, they get stuck in a shorter position. They're not able to fully extend or straighten the hand. And they're not able to grip as well. It could happen to any part of the body, not just the hand. It could happen to the elbow, the shoulder. It could happen lower body. And the reason you want to measure in the joint range of motion and also the flexibility is just to see where the limitations are, or to try to address that. And if a good measure for functional testing and for muscular strength and endurance It's going to be an 8 to 10 rep max. So this is the maximum amount of weight they're able to lift with proper form for 8 to 10 reps. And performance testing such as a 30-second sit to stand and is also ideal because it's functional. And it's incredibly important to focus on day-to-day functional activities of daily living for those with MS. And these are some different exercise testing techniques you can use. For aerobic, you can use an Airdyne bicycle, recumbent bike, or recumbent stepper, 12-minute walk test. And what you're looking at is where their VO2 peak is, or what their METs are, heart rate max, volitional fatigue. That's when the person decides, either consciously or subconsciously, that they just cannot do anymore. And then for strength, like I said, an 8 to 10 rep max, you're just looking at the weight. Manual muscle testing is when you test different muscles and how strong they are as an individual as compared to a group, such as testing the biceps muscles separately, not just together. The 30-second sit to stand, and that's looking at a functional test. And then, like I said, you also want to look at flexibility. So you look at goniometry, sit and reach, and for goniometry, you want to focus on as many of the joints in the body as you possibly can, and that way you can monitor for the possibility of a development of contractures. Now for neuromuscular, you also want to look at their gait analysis and balance, muscle tone, fatigue. This way, you know what is safe for them and what's not, and where you need to focus. Now I'll get into some exercise prescription. So, following the principle of frequency, intensity, time, and type. For frequency, earlier in the disease process, or those with a mild case or a slowly progressing case, it's similar to what you would do for someone who is healthy. So aerobic is going to be about 3 to 5 days a week. Resistance about 2 days a week. But flexibility you can do every single day, and even up to twice a day. Just depends on their needs and their goals. Intensity, aerobic you can do about 40 to 70% of their VO2 reserve or heart rate reserve, or an RPE of 11 to 14 on a scale of 6 to 20. So this would be about moderate intensity. Resistance is also roughly moderate. It's about 60 to 80% of their 1 rep max. You can calculate the 1 rep max based on how they do with an 8 to 10 in rep max in exercise testing. Flexibility, just like what you would do for a healthy individual, the point of tightness or mild discomfort. It's okay if it feels tight, but you don't want them to feel pain. Then for time, aerobic, you want to increase to a minimum of 10 minutes and then progressively build up to 20 to 60 minutes. This is for people who are not currently active, but similar to what you do for someone who is healthy. For resistance, about 1 to 2 reps of 1 to 2 sets, of 8 to 15 reps. And then flexibility, about 30 to 60 seconds, 2 to 4 reps. And if necessary, this may actually extend and even longer than a minute, just based on the degree of muscle spasticity or a development of contractures. And then this is just a little summarized version, what I was talking about. And there's some special considerations. You want to consider how fatigue is going to impact their performance. I'm sorry, don't know what happened there. Okay. So, the way you take that into consideration, and you can either reduce the intensity, and you can have them exercise earlier in the morning. They may also experience impaired balance. So for that, you may change the type of exercise you want to use. You can also use things such as foot straps. Heat intolerance. So that's the same thing as